Hello and welcome to Solinsky EyeCare's Focus on a Doctor Biography today. My name is Alan Solinsky and I'm here to interview Dr. David Jeng. David Jeng's been with us since 2012 and he has added an unbelievable dimension to our practice. His work ethic is second to none and his compassion towards his patients is unbelievable. Patients remark at what a proficient doctor he is and how nice he is as well. And I've observed him in the operating room and heard nurses say that he's one of the best surgeons in all of Connecticut. So, without further ado, I want to get everybody to know Dr. Jeng a little bit more. Why don't you tell us about where you were born and what you did growing up?
Well, thank you for the nice introduction. I was born in New York City, and I grew up on Long Island, so I'm from the Northeast, and basically spent my entire life out here. I went to school up at Harvard for undergraduate, and then I received my medical degree down at Yale. So I spent most of my life here on the East Coast.
Great. What were some of your extracurricular activities and hobbies as a high school person at Harvard?
Well, a big part of my life has been music, classical music. I played the viola when I was younger, and I'd love to get back into it, but I spent a lot of time during high school and college playing classical music, playing in groups and orchestras. I also did taekwondo, and I did something called the Chinese yo-yo, which is a traditional Chinese performance art.
And in medical school, what was the turning point that you decided to become an ophthalmologist?
Really doing my ophthalmology rotation, I met my role model. It was the chair of the Department of Ophthalmology at Yale, and he was really a gentleman and a scholar, and he inspired me to be the best doctor I could be and to provide the best care I could for my patients.
Tell us about your ophthalmology training. Where did you go and what was that like?
I trained out in Los Angeles at an institute called the Doheny Eye Institute. It's associated with the University of Southern California. I spent most of the time there training at the LA County Hospital, which is one of the busiest hospitals, county hospitals in the country. And so we saw patients from all walks of life in all different situations, from trauma to serious illnesses who had to be admitted to the hospital, as well as general eye disease as well.
Good. Tell us about your medical retina fellowship.
So I did that out in London at a prestigious eye hospital called the Moorfields Eye Hospital. It's probably one of the oldest and largest eye hospitals in the world. But I spent a year there specializing in medical retina diseases, such as diabetes, age-related macular degeneration, and vascular occlusions in the eye. And it was an excellent opportunity to be at a large hospital that had a lot of pathology, and so I experienced a lot and learned a lot there.
Good. Tell us about your first year at Solinsky EyeCare so far.
Well, it's been great. Dr. Solinsky's been really supportive of me in developing the medical retina side of the practice. We never had that here before, so it's been excellent expanding that and growing that specialty here at Solinsky EyeCare. Also, the patients here have been wonderful working with them. They've been very grateful for the help that I can provide them, and it's been a pleasure working with the staff here as well.
And what are some of the unique procedures you're able to do for the diabetics and the people with macular degeneration?
So there have been huge advances in medical retina since the early 2000s. We actually do injections of medications into the eyes now that seem to really preserve vision and improve vision for a lot of these patients with diabetes and macular degeneration. I also do specific types of laser on the retina in terms of, depending on the type of disease that they have. But those are the main new treatments that are available to us now.
Now, talking about new treatments, cataract surgery is undergoing a revolution with the laser-assisted cataract surgery and lens implants to correct astigmatism and let people see up close and far away at the same time. Tell us about some of those things.
Definitely. Cataract surgery itself has gone through huge advances since the 1980s. things have progressively gotten better and better. And over the past few years, we've been able to offer specialty lenses that allow patients to really see the best they can after cataract surgery. Not only not having to wear glasses for distance vision, but now with multifocal lenses, they can also see up close as well as far away very clearly. And these are huge advances. But most recently, we've been able to adapt a femtosecond laser to cataract surgery to help us make the surgery more precise and safer for the patient.
Great. When did that start?
So the laser was first approved in 2011, and we obtained one of those lasers here in the surgery center that we operate in the end of 2012, and we've been using it since then. We've been having great results.
Fantastic. Tell us a little bit about the new East Hartford office that we've opened up that you go to on a weekly basis.
Sure. We noticed that we have a lot of patients coming out from East Hartford, and we also realize a lot of them, for a lot of them, it's a trek to come out to West Hartford, and also that there's a large patient population that's not being served out in East Hartford. So we really wanted to bring our services to them, and so I've been going out there once a week to see patients and really to make it more convenient and better for our patients.
Wow. What motivates you to do all of this?
Well, you know, I feel fortunate to be here at Solinsky EyeCare, to be part of the team here, because I feel like our goals and missions really coincide in terms of aiming to be the best that we can be, and aiming for excellence in terms of the best care that we can provide to our patients and giving them the best vision they can possibly have, and also the best experience that they can have as a patient here in a doctor's office. And so really, all this is really trying to do the best for our patients.
Any other comments you'd like to make?
Well, I just really, we wouldn't be here without the patients, so I want to thank everyone for being part of Solinsky EyeCare.
Thank you very much.